Well, Prynawn da, good afternoon. Welcome to you all to the latest Ask FM live session. Thank you all very much indeed for joining us. Lots of questions in already and hope to be able to rattle through as many as we can manage in the 30 to 40 minutes that follows. I'm going to start with an easy one because there have been some questions about the new coronavirus control plan that we said a week or so ago that we would publish, and I'm pleased to say it's been published this afternoon. So it's intended to be an enabling plan, a plan to help us find a route out of lockdown. It has inevitably got some sobering things in it as well about the risks that are still there, and no doubt we'll talk a bit more about that during the afternoon. But the plan itself published today and available for anyone to see. Not surprisingly, a number of questions about vaccination, given that it's been in the news such a lot this week. Now, the position is that the UK government is responsible for getting the supply of vaccine. Then when the supply of vaccine comes into Wales, it's the job of the Welsh Government to make sure that it is distributed and used. And so far, as you'll know, the programme has been a fantastic success. The UK government has done, I think, an excellent job in securing vaccine for the United Kingdom, and we've been able to use everything that we get to have the fastest rollout of vaccination anywhere in the UK. Now, we heard in the middle of this week that quite a large number of doses that we were expecting in the next 4 weeks won't be coming to Wales. And that's because a large shipment from India is delayed coming into the United Kingdom. And every part of the United Kingdom is having to see a reduction. We are doing everything we can to make sure that we can offer vaccine to all people on the top 9 groups, the 9 priority groups, by the middle of April. Now, that will be a stretch because we're losing 225,000 doses. And you can't do that without it having an impact. They will come to us later, so they're not lost completely, but they are lost over the next few weeks. Nevertheless, the people who run the programme doing everything they can. That was a question from Sian. Do we have the amount needed for the 1 to 9 groups? Well, it's a stretch now, but we are working as hard as we can to make sure we can do it by the middle of April. And then some other people have asked, what happens beyond that? Can we reach all adults by the end of July? Well, as I said, the good news is that while we don't have the vaccine coming in the next 4 weeks in the volumes we hope for, it will come in 4 weeks' time. So that will help us then get back on track for the groups that follow after the 9 priority groups. Lots of questions coming in from people, as we'd expect. So I'll go to a few of these now next. A question about why we think it's now safe for people to stop shielding. Well, shielding has only ever been advice. And as we aim to lift the lockdown for the population at large, so we think it's fair to provide new advice for people who are shielding. And that explains to them that coronavirus has now been more effectively suppressed, that if you've been vaccinated and if you're in the shielding group, then you will be being vaccinated, then you've got some level of protection and that you can make a different set of judgments. But it is advice. And I know last time when we said to people they could do a bit more if they wanted to, quite a lot of people chose not to. And that's fine too. It's for people to take the advice and apply it in their own circumstances. A question about the £500 payment we are giving to health and care staff. And we announced that this week, and I'm very pleased indeed we've been able to do it. We've depended hugely on our health and social care staff over the last 12 months. The UK government proposes no increase in the pay of social care staff next year and a 1% increase for health staff. Now, what we've been able to do this week is to announce £500 for everybody. And people are asking, why are we paying the national insurance and tax on top of that? Well, it's because if we don't, the Treasury in London will take that money away from people, as they did when they did this. We did this last year, and people end up with less than the £500 we'd like them to receive. So we're doing it to make sure people get the full 500. Quite a few questions about the reopening of indoor sports and gyms. Some people asking why aren't they higher on our list of things to reopen? Well, look, the principle that we have tried to adopt in our plan for reopening is that we start with the less risky things first. And I know that there are gym owners who don't agree that gyms are a higher risk venue, but all the advice we get as a Welsh Government from our technical advisory group or group of experts from the Chief Medical Officer doesn't agree with them. There is evidence around the world that coronavirus can spread when people are in gyms, when people are exercising hard, breathing out, sometimes in close proximity with one another. And at these early stages, we don't think it is the right thing to do to open gyms and leisure centres in the first tranche of things. I have said, however, that after the 12th of April, when we've completed the things that we have said so far, then gyms and leisure centres will be on the table for the next round of easing restrictions. Because I do absolutely recognise the mental health as well as the physical health advantages from gym opening. If it's still safe, if things are still going in the right direction, it's safe to reopen them after the 12th of April, that's what we will plan to do. But the health of the public has to come first, and that's the lens that we will be looking at that through. Questions coming in about the wedding industry. Any dates? So that's useful because it's in the same group of things for after the 12th of April. There'll be a 3-week review after the 12th of April, and we've said that there will be a handful of things on the table as the things we will look at then. Gyms and leisure centres, weddings, outdoor hospitality, and extended households. I cannot for a minute say we will be able to do all of those things, all at the same time, but they are the next group of things that we will be looking at, and weddings is one of them. A lot of questions about people travelling back across the border from Wales to Scotland or to England. At the moment, the rules in England wouldn't allow anybody to travel into Wales. The Prime Minister set out his roadmap for England. At the moment, they've been in the stay-at-home category. And when they move to stay local, as we have already done on Monday of this week, the instruction in England will be that people shouldn't stay overnight anywhere and that they shouldn't travel far from home. So while that is still the position in England, if it's not safe for people in England to stay overnight in England, then it couldn't possibly be safe for them to come and stay overnight in Wales. But we'll continue to look at that carefully, and if the position changes, then we'll consider that as well. So there's a question from Jill. Can she visit her holiday home in Wales? She lives in England. Well, the answer to that at the moment, Jill, I'm afraid, is no. But it's not the rules in Wales that are preventing that. It's the rules in England that say that you can't stay overnight anywhere and you shouldn't be travelling out of your own locality. Another question here about holidays. How likely do I think it is that people will be able to travel abroad to Spain and so on for holidays in June? Kelly is asking that question. Well, I have to say that I think that is a very difficult question. If you think of how coronavirus started in Wales last year, the first cases ever to come into Wales in February last year came when people went on holiday to the north of Italy skiing. The virus was already circulating in the north of Italy, and the virus came back into Wales when people returned. In September, after a very good summer, numbers in Wales rose far faster than we had expected, and that again was at least partly because we had people returning to Wales from Spain, from Germany, from Greece, from Italy, from France, from Turkey, from Bulgaria, you name it. We had people coming back into Wales where the numbers were very low, from parts of the world where the numbers were high, and bringing the virus with them. I really don't think that that is a sensible course of action. Many of you will have seen that yesterday, Paris in France has gone back into lockdown for another 4 weeks. And that just tells us that, the risk of re-importing the virus into Wales hasn't gone away. And that is especially a risk when we know that there are new variants of coronavirus happening in other parts of the world. We've already had examples of that in Wales, variants from elsewhere coming to Wales. I don't think this is the summer to risk that all over again. I'll be going for my holiday in Wales this year. Fantastic place to visit in Wales. Question from Anthea about socialising in our own homes. Is there a date for that? Anthea, mixing indoors is the most risky thing we can do. Mixing outdoors is far safer. Mixing indoors, much riskier. But it's in the group of things, those 4 things I mentioned, that will be on the list of things for us to think about and make decisions about after the 12th of April. Gyms and leisure centres, weddings, outdoor hospitality, and extended households. So it's there on the list, but not yet. Hannah asking about caravan sales. She has a deposit on the one they hope to use at Easter. Well, I'm hoping you'll be able to use it at Easter. And our aim is to begin opening up the tourism industry, starting with self-contained accommodation. And to do that from the 27th, 29th of March, in time for people to be able to use caravans over Easter. So with a bit of luck, Hannah, you'll be able to do that. Kirsty asking about when non-essential shops will open. Well, the good news there is that shops that are already open, so that's supermarkets, but other shops that are open already, they will be able to sell non-essential goods from Monday the 22nd. So I know it's been a long time since people have been able to buy things like children's shoes and children's clothes. So there will be opportunities to do that now in Wales as from Monday, and the whole of non-essential retail, provided things remain on track, will be able to open on the 12th of April. That's the same day as it will be able to reopen in England, but we will have been able to reopen it in supermarkets and other places that are open already earlier than that, starting on March the 22nd. Another question about vaccination. Mark asking, why do we need to vaccinate healthy people? Shouldn't we just be vaccinating the elderly and the vulnerable and those who want it? Well, look, the good news is we've already completed offering vaccination to all those people in the top 4 priority groups, and that includes care home residents, health workers, people aged over 70, people aged over 80, and now people with underlying health conditions as well. So, we're well into the things that Mark thinks we should be doing. Why are we going beyond that? Well, until we have an effective vaccine covering as many people in the population as possible, then the risk of coronavirus coming back will still be there. And it comes back amongst healthy people as well. It's one of the myths about coronavirus, that for healthy people, it's just a short illness that doesn't bother you very much at all. I can tell you that I read letters from people who were absolutely healthy, people in their 30s and their 40s, who fell ill with coronavirus and whose lives have been devastated by it. They are taking not weeks but months to recover. They feel ill all the time. They have what's called long COVID. So please don't think because you're healthy today that you're immune from this virus. It can attack anybody, and it can attack anybody really seriously. So just two other points to make. If you know of anybody who's missed out, and I know that some people, when they were first invited, may have thought, oh, I don't want to be vaccinated. If people have changed their mind, they should just get in touch with their health board. If you know anybody, just help them to get in touch. It's never too late to be vaccinated in Wales. And if you're in one of the new groups, so I'm being invited now, please, if you're invited to be vaccinated, say yes. 1.2 million people in Wales have already done just that. And you're helping not just yourself, but you're helping everybody else as well. Questions on driving lessons. First of all, can I say that I feel very much for people who work as driving instructors. I know they've not always been well covered by the help that the UK government has provided, and the UK government has provided a lot of help, let me say that, and we've used our money to try and fill the gaps in their programmes, but I know that it hasn't always worked well or easily for driving instructors, and they want to be back in work. Well, today, the DVSA, the organisation that's responsible for driving lessons and driving tests, has published their plan for the future. Their plan is that driving lessons could resume from April the 12th, and driving tests could resume from April the 22nd. So what we will do now is we will talk to the DVSA, we'll talk to the bodies that represent driving instructors, and if the public health position in Wales makes it safe to do so, then we will aim to follow the advice of the DVSA. So that's lessons starting from the 12th of April, tests from the 22nd of April, but, and it's just really important that I say this, it will depend on how things are closer to the time. At the moment in Wales, things are going well. The numbers of people falling ill with coronavirus are going down. The percentage of people who go for tests who have coronavirus is going down as well. The number of people in hospital with coronavirus is falling every week. If we can keep that going, then when we come to the 12th and the 22nd, we'll be in a good place to fall in with the advice of the DVSA. But if things go in the opposite direction, then of course we would have to think again. A few more questions coming in, and maybe it's people joining us as the session goes on, about whether we're on track for the over 50s to get their vaccine by the middle of April, and whether we can get the vaccine to all eligible adults by the end of July. So just to repeat what I said, we've lost quite a lot of vaccine in the next 4 weeks because of an interruption in supply coming from India. We're doing everything we can to vaccinate everybody in the top 9 priority groups by the middle of April. It's going to be a stretch now with the volume of vaccine we have, but the people who run the programme, who've made a real success of it, will be working really hard to make sure we can do that. The good news about the 250,000 vaccines we're not getting in the next 4 weeks is we will be getting them in the 4 weeks after that. And that will help us. That'll be a boost to our ability to complete the vaccination of all adults by the end of July. There's a question about whether Wales will catch up with England in vaccinating the people in their early 50s. I know that people get their information from lots of different places. Let me just give you some facts on the matter. We have vaccinated a higher percentage of our population in Wales with the first and second dose of vaccine than any other part of the United Kingdom. And what's called the 7-day rolling average, the number of people we vaccinated in each of the last 7 days, again, as a percentage of our population, we are the top of that list. More than England, more than Scotland, more than Northern Ireland. Now, about 40% of people in their 50s in Wales have already had their first jab. And we will go on adding to that every day. We've been vaccinating 1% of the adult population in Wales every day recently. And today's figure of 38,511 people, is right there at the top of the list of the number of people we've ever done in one day. So although there are bumps in the road, and it's not good news that the supply of vaccine from India is delayed, the programme as a whole has been an outstanding success. An even more outstanding success in Wales than anywhere else, and we'll be working really hard to keep it that way. Alana asking if we are able to work from home, should we still do so? And the answer to that is yes, please. Working from home is one of the big things that people can do to help. So if you're able to work successfully from home, that's exactly what we are asking people to do. It's exactly what's happening in the Welsh Government here in the building I'm sitting in. Normally 2,000 people will be in this building. There have been fewer than 200 every day this week, and that's because people can work successfully from home, and that's what we want to see. A question from Mr. Goodwin asking when outdoor fitness classes can start. And actually, in a very modest way, they have already started. Because as from Monday, just gone, 4 people from 2 households can meet outside for any purpose. And I've seen messages from fitness coaches and so on who are already offering sessions outdoors. Outdoor gyms are open, so people can use those as well. You can play golf, you can play tennis, you can go fishing, you can even practice on a basketball court, but it's only 4 people, and it's got to be from 2 households. Those 2 households can change. It can be a different 2 households on the following day, for example. But outdoor classes on that modest basis have already started to reopen in Wales. A question about whether children can be vaccinated. And what's happening there is that the manufacturers of the vaccine are now carrying out trials of the vaccine with children. Of course, the doses have to be different, and the trials have to test for different things, and they're not completed yet. That's why at the moment there isn't a license for the vaccine for people under the age of 18. For children with very exceptional medical conditions, doctors can make an exception. But for children as a whole, we are waiting for those trials to happen and for the results of them. Provided the vaccine is safe and effective, then of course there'll be a strong case for children being included as well. Some questions coming in about financial support, especially for those places that are not able to reopen and won't be able to reopen until the 12th of April. So we've set aside an extra £150 million in the Welsh Government's budget in this financial year to be able to help those businesses, and that comes on top of, over £2 billion. £2 billion worth of money that has been provided to support businesses through this extraordinary year in Wales. 1.9 billion of that has already left us and gone into the bank accounts of businesses who've been affected, and here's another £150 million to be used for those places that can't reopen. In next year's budget, so the budget that starts in April, we've already earmarked another £200 million, because there will be some businesses who will inevitably be at the end of the queue for reopening. And I see there are some questions about some of them. Festivals, large outdoor events, conferences. Look, anything that brings a lot of people together, even outdoors, creates additional risk. So the principle I said at the beginning, we start with the things that are the least risk, and then we move on to things that are more risky if the virus is still effectively suppressed. Because we know that that will take time for some businesses, we've set aside another £200 million at the start of the next financial year. I know, when I see the question from Juliet, I know that she'd rather be working, that she'd rather be trading, she'd rather be making a success of her business. But while it's not safe for us to allow that, there will be more help from the Welsh Government. A question about new variants and whether there are more out there at the moment. Well, the first thing to say is that there are indeed always new variants. It's just the nature of the virus. It's what it does all the time. It's always changing, it's always developing, it's always trying to find new ways of making itself successful. So we've had variants come into Wales from elsewhere in the world. And there's no doubt at all that there will be new variants elsewhere. And that's why we've got to be so careful. So we've had variants from South Africa. We know there are variants in Brazil at the moment. We've had our own Kent variant that has been spread to other parts of the world. I'm afraid we can't imagine for a minute that there won't be more out there and that we've got to be vigilant for them all the time. A question about how long the stay local rule will stay in place and when we hope to be able to lift it. So we moved last weekend from stay at home to stay local. Thank you to those people who contacted us to say how much they'd appreciated that over the weekend, how it had allowed them to go to see their mam gi or their mum in the garden on Mother's Day. Now, I hope that this will be here for 2 weeks. This week and next week, and then we'll be able to go beyond that and let people travel anywhere in Wales. And if we're going to be able to allow people to go back to the caravan or to other self-contained accommodation, then we'll need to do that. So that is part of the plan. We'll wait until the end of next week, another week's worth of data, to make sure we're making the decision in the best set of circumstances and knowledge that we have. But if we can do it, that's when people will be able to travel more than 5 miles. And there was a question from Lynn that came in just before the session started, asking whether motorhomes are being classed as self-contained, same as caravans. And I'm pretty sure, I'm relying a bit on memory, but I'm pretty sure that the answer to that is yes. That last year, when we allowed self-contained accommodation to open, we included motorhomes, provided they've got a toilet and a shower inside them and their own cooking facilities. I remember we asked people not to just move on every single day from one place to the next, but to stay a minimum number of days at any one location. And that's because if anybody does fall ill with coronavirus, our TTP system needs to be able to get hold of them. And if people are moving all the time, then that gets quite a lot more difficult and complicated. But motorhomes, the answer I think is yes. Matthew asking about whether the vaccine is having an impact on hospital admissions. And I think the answer to that is yes. I think we're still at the early stages of it, but the number of admissions is going down faster than the model that we had originally suggested. And to my mind, the best explanation for that is that we are beginning to see the impact of vaccination. So the people most likely to end up in hospital were older people and people with underlying health conditions. We've offered the first dose of the vaccine to almost all of those people now, and a lot of them have had the second vaccine as well, and I think we're beginning to see that make a difference. That is why it is so important, isn't it, for people to take the vaccine, because it really will help to protect the health service. Mark asking me a question not to do with coronavirus, asking me whether members of the Senedd are going to take a pay rise. First thing to say is that is not up to me. That is for the Senedd to decide, not the Welsh Government. My own advice is that the answer should be no. That in this extraordinary year, with an economic crisis as well as a health crisis, and with other people's wages being held down, now is not the time for Senedd members to be having a pay increase. I understand some of my fellow politicians will say to me it's never a good time to increase the salaries of people who are elected, and I understand that point. And I want people to be paid properly for the job so that we attract good people into doing these jobs. But in this extraordinary year, I think the answer for me is no. Brian is asking me another question that's not to do with coronavirus, but I'll answer it. He asks me, what is my favourite choice of sandwich? Now, I once answered a question about cheese in one of these sessions and went off on one about just how much I like cheese. So if I had to choose just one sandwich, Brian, then I would choose a cockle sandwich. When I was growing up at home in Carmarthen, on Saturday night, my mother would boil up a big pan of cockles, brown bread and butter, and strong tea. And that's what we would have for our supper. And if I had to choose just one, that's what I would have again. Back now to some questions about coronavirus itself. And some questions from people living in Ynys Môn on Anglesey, where we've got rising numbers again. We've got rising numbers in two parts of Wales. We've got rising numbers in Merthyr Tydfil, and we've got rising numbers on the island of Anglesey. Look, the first thing to remember is that they are amongst our two smallest local authorities, where relatively small numbers of people contracting the virus lead to quite big increases in the rates per 100,000 that we report every day. But what we are doing is working with the local council on Anglesey to put extra testing onto the island to make sure that we get on top of the outbreak, and people on the island and in Merthyr can help as well. In fact, they can offer the best help of all. Stick to the rules. Please, no going in and out of one another's homes. That's where we are fearful some of these numbers are coming from. And let me say to people who've been vaccinated, that's not a reason for ignoring the rules at all. Even if you've been vaccinated, more than half of people in Wales haven't been. And even if you have been vaccinated, it doesn't give you protection for at least the first 3 weeks. So please, the best thing, the thing that will help them most of all on Ynys Môn and in Merthyr is to stick by the rules, and we will play our part with the more testing that we are going to bring onto the island. A question for Emma asking if small businesses have been excluded from the latest round of ERF, Economic Resilience Fund funding. No, the answer is no, they haven't been. I'm pleased to be able to say that the £150 million extra will go almost exclusively to small businesses. Some of you will have followed the bit of argy-bargy which followed when we decided not to provide rate relief to very big businesses, the big supermarkets, for example. We did that because it freed up tens of millions of pounds for us to be able to give to small businesses in Wales. I've seen a figure, I may not remember it absolutely exactly, but I think it said that 98% of all the money that the Welsh Government has provided has gone to SMEs in Wales, small and medium-sized enterprises. So, Emma, the answer is yes, small businesses will get help from the latest round of funding. When coming towards the end, I think, of the time that we've got, I'll just check whether there were some questions that came in before we were able to start. I'll just do a couple and then time will have defeated us. One is on teenagers. How many teenagers can meet outdoors? Well, at the moment, teenagers are covered by the same rules as everybody else. 4 people can meet outdoors for any purpose, not just exercise. They've got to come from 2 households. So 2 teenagers from one household could meet up with 2 teenagers from another household and do that outdoors. And a final question coming in about the TTP system, the Trace, Track, Protect system, the contact tracing system. How well is it working, the question said, and is it being funded for next year? Well, again, I think the answer is that it's been a fantastic success here in Wales. We managed to contact, or the system managed to contact, over 95% of all those people who fell ill with coronavirus last week, and over 90% of their contacts were contacted as well. That's as good as it gets, really, as good as it is anywhere in the United Kingdom and better than most. And in fact, in the money, well, you'll have seen some reports of the very large sums of money that have been spent in England. Our system has cost us an awful lot less because we haven't used any private companies. We haven't used any consultants on £1,000 a day. We've used people working in the public service, people working in local councils, in the health service and in local areas as well. And yes, we put £60 million aside in next year's budget. That's enough, we think, to go on paying for the system up until September of next year. And if we need it more than that, then we'll find the money beyond September as well. There's one question come up on the screen, if there's time, so we'll do it. Helen asks, can you clarify the rules for mobile hairdressers? Well, many of you will know that hairdressers and barbers opened again on Monday of this week, or the 15th. Some of us were very grateful indeed that happened. Mobile hairdressers can trade as well. They're covered by the rules. They're allowed to go into someone's house to give a haircut. Of course, they should follow the rules. They should be PPE. They should be doing all the right things. They shouldn't be staying in the house. It's for the haircut and gone. But yes, mobile hairdressers are also able to work again in Wales. Well, phew, thank you once again. Apologies to those people whose questions I'm sure haven't been reached, and sorry that, as ever, it's a bit of a gallop through everything that to try and get through as much as we can. Look forward to the weekend. I'm sure many of you will be doing the same. Looking forward to watching Wales against France tomorrow evening. Pob lwc i Gymru. Best of luck to Wales, and hope that you enjoy the weekend as well. Diolch yn fawr. Thank you all very much indeed.